I'm Brian Paddock with KTRG. I'm not sure if I'm calling number 2 or not.
Thank you, Brian. I have you on the list.
Go ahead.
Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check.
How does that sound, Brian?
Sounds good.
Thank you.
Just a reminder that the live mic on YouTube.
Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Podium mic check.
8, 7, 3, and 1. Yeah, I just work weekends, so I work Saturdays and Sundays. So is that home with that? He's been working from home too. So. You're welcome. Thank you. Oh yeah, sure. And I let
You could see me smile. I just smiled at you, but you probably can't tell. Okay, it's all good.
Where are we at, Michelle? 2 minutes?
90 seconds.
90 seconds.
Good afternoon. My name is Stacy Walker, and I have the honor and privilege of serving on the Linn County Board of Supervisors. As many of you saw my face mask that I'm sporting today, a dear friend of mine, Erica Clayton, made this, and you can check out her creations on Queen E Creations on Facebook. I have a few topics to address today, and I will start with the governor's new proclamation issued yesterday that allows the opening of private and public campgrounds. Linn County Conservation will be opening campgrounds at 5 a.m. Friday morning. That's tomorrow, May 8th. This includes the campgrounds at Buffalo Creek Park, Morgan Creek Park, Pinnakin Ridge Park, and Squaw Creek Park. The campgrounds are opening on a modified basis to ensure social distancing, continue best hygiene practices, and promote a safe and healthy environment for park visitors and employees. The Linn County Conservation Board, with the guidance of public health officials, will be following the Iowa Department of Natural Resources practices and implementing the following guidelines. Campers may camp with a self-contained camping unit that has a functioning self-contained restroom, as shower houses with flushable restrooms will remain closed. Self-contained is defined as a tent or pop-up camper with a portable toilet or an RV with a functioning self-contained bathroom. Occupants are limited to 6 or less per campsite, and no visitors are allowed. Social distancing guidelines should be observed in the campground at all times. The Linn County Conservation Department is pleased to provide this outdoor recreation opportunity at this time and thanks all campers for cooperating with these guidelines. We continue to encourage other members of the public to enjoy the physical and mental health benefits of Linn County Conservation's parks, trails, natural areas provide while practicing responsible social distancing recommendations. Now, National Nurses Week began yesterday and runs through May 12th. It is 1 week dedicated to recognizing and honoring all nurses who work in our community. Nurses are on duty in our county 24 hours a day, 7 days a week. Nurses work in our schools, in long-term care facilities, in some of our larger corporations. They work in our correctional facilities, private practice offices, and community health centers. They are helpers, and they go where they are needed. We feel it is especially fitting during the COVID-19 crisis to join with the American Nurses Association to recognize these hardworking, steadfast healthcare heroes. We realize that it takes all healthcare workers, from the people who clean the rooms to those who perform intricate surgeries, to make our health system so great. But we wanted to carve out this time to specifically recognize and honor nurses who are known as the heart of healthcare. There are nearly 4,000 registered nurses and licensed practical nurses in Linn County. Our special thanks to all of them for keeping us safe and healthy. And to those nurses fighting COVID-19 on a daily basis, a very special thank you from a very grateful county. We've joined together to honor nurses by creating this commemorative t-shirt that we are all wearing today. And also, we have displayed our gratitude on billboards that you'll start to see all around the county with the generous donations from Lamar Advertising and Media Quest Outdoor. It is my hope to be able to release these t-shirts to the public for sale and use the profits to support our nurses and healthcare providers here in the county. Today, I'm joined by Cedar Rapids Mayor Brad Hart and Marion Mayor Nick Abuasili to help recognize just 2 of these healthcare heroes. One is from Unity Point Health, Cedar Rapids, and the other is from Mercy Medical Center, Cedar Rapids. I'd now like to introduce Cedar Rapids Mayor Hart.
Thank you, Stacy. Noelle Baker is an intensive care nurse at Mercy Cedar Rapids. She's been a registered nurse for 4 years, the last 2 years at Mercy. Noelle says she never imagined she would be dealing with a reality that we're all dealing with right now, caring for patients in the midst of a global pandemic. Noelle works 12-hour weekend shifts, often on Mercy's COVID-19 unit. One of the more emotionally difficult aspects of her job is helping families communicate from a distance, of course, with their loved ones who are being treated for the coronavirus. She recalls a recent experience when a family member asked to speak to her mother, who was on a ventilator and in critical condition. Noelle held the phone to the patient's ear as the patient's daughter carried on a one-sided conversation, reading Bible verses to her mother and telling her how much she loved her. As a mother of 4 young daughters, this was an especially sad and powerful moment for Noelle. Noelle, thank you from all of us for what you do. And please carry our thanks back to everyone who works with you at Mercy. We do have a small token of our appreciation for you, some cookies that have our thanks on it to take back to your department at Mercy, and a t-shirt that I hope you'll proudly wear. So thank you again for all you're doing. Please stay safe.
First, I would just like to thank everyone for the support and acknowledgement of Nurses Week. This year, Nurses Week is a little bit different for all of us. I love my job, and caring for and helping people is part of my DNA. But as a mother of 4 daughters and a wife of my husband who's immunosuppressed, I will admit that working during this time has brought on a lot of stress and fear. The fear that I will bring this home to my family weighs on my shoulders every day. I, as well as my coworkers, have had to change up a lot of our routines in order to try to prevent ourselves from bringing this virus home with us. I personally shower at work prior to leaving the hospital, and then once again when I get home. When I enter my home, I have to race to the bathroom and dodge my children so they can't touch me prior to showering. And I know that this has been the case with a lot of other healthcare workers as well. This has been a trying time for us all, but the one thing that has helped lighten the whole situation and has been the outreach of support and or just outreach for support from the community. I think that I can speak for all healthcare workers when I say thank you to everyone for all the continued expressions of gratitude for the work we are doing. Thank you for the meals, the parades, the chalk art, the time that people have taken out of their days to make us masks, and among all the other generous ways that you guys have all shown your support. We really do appreciate it. And I just want to say that we are all in this together.
Good afternoon. I'm Nick Abouassali. I have the great pleasure today to introduce Molly Eilers. Molly is a nurse manager of the orthopedic unit at Unity Point Health in Cedar Rapids. She's been a registered nurse for 19 years, working 5 years at Unity Point Health. She has a strong critical care background, and this year Molly was named as a 100 Great Iowa Nurse. Molly has served as a bedside nurse, care coordinator, and nurse manager in a critical care setting. She's passionate and dedicated to caring for patients. Molly is also a strong nurse leader who leads by example. She nurtures and mentors new nurses. Molly's 100 Great Iowa Nurse Nominator wrote, "Molly is one of the brightest and most compassionate nurses I know." These are just 2 strong examples that you've seen today of nurses in our community. We are so proud of all of them and the work they do to keep us healthy. Molly, thank you from all of us. And just as for Noelle, we have a small token of our appreciation, some cookies with our message printed on them to take back to your department. Please carry our thanks to all who are working in your department. From Stacy, and from Mayor Hart, myself, and everyone in Linn County, we thank you.
Thank you for the warm welcome, and thank you for having me here today. I would like to take a moment to wish nurses across Iowa, especially those in Linn County, a very happy Nurses Week. Navigating the uncharted territory of a pandemic is unlike any experience I have ever had in healthcare. The pandemic has required us to deliver care in a way we never have before. We have been forced to think creatively to maintain staff and patient safety while delivering deeply compassionate and competent care. As a nurse leader at Unity Point Health, Cedar Rapids, it has been inspiring to see our team rise to the occasion during this pandemic. None of this should come as a surprise to me because this is what we as nurses are called to do, to care for those in need in any way possible. I speak for every nurse across Iowa, and especially those in Linn County, when I say thank you to our patients for the opportunity to serve you. It is truly a blessing and honor to do so. Thank you.
We also want to recognize the nurses who are not working during this crisis due to furloughs and other barriers. Your sacrifice is not forgotten. Our hearts are with you as well. Our hope is that Linn County will safely reopen soon, and you can go back to working with patients and with families. And as a reminder to us all, nurses and all healthcare workers are really not on the front lines of this crisis. You are. Every citizen is on the front lines when you decide to social distance, when you decide to wear a mask, when you decide to wash your hands, when you decide to sanitize. These nurses and all healthcare heroes, again, are not on the front line, but they are our last line of defense, and we honor them by doing what we can to keep one another safe. Help these nurses and all healthcare heroes do their job by doing your job. Simply follow the guidelines. Heather, this is me using my mom voice. And I have one last nurse to recognize, and that is our very own Heather Medor. Heather received her nursing degree from Lewis University in Illinois. She moved from nursing to public health after the H1N1 outbreak in 2009. And now she is a vital part of our COVID-19 emergency response efforts. Heather has served as the spokesperson for Linn County Public Health during this crisis and represents the amazing team of nurses and public health professionals working hard at Linn County Public Health during this pandemic. Heather, you have been a reliable and steadfast leader throughout one of the greatest challenges of our time. You didn't ask for this role, but you stepped up to the plate when your community needed you. During the COVID-19 pandemic, the nurses at Linn County Public Health have a more visible role in protecting the health of our community. Normally, they work to prevent communicable and chronic diseases of many types. During this pandemic, their efforts are focused on educating our community and preventing the spread of COVID-19. Normally, when the public health system is working efficiently, public health professionals, including nurses, largely go unnoticed by the community. As many people in public health say, when public health works, we are invisible. During a public health emergency, our work becomes more visible and people can see the work that traditionally happens behind the scenes. Heather, you must have been a long-distance runner in a former life because we all know you view everything as a marathon. And if this community is to have anyone leading the pack, I am so thankful that it is you. We trust that you're going to get us to the finish line, and we thank Heather and all of the other nurses at Linn County Public Health and all other public health professionals serving in other capacities for their hard work and their brave work during this pandemic. Now, a bit of a transition here. I want to talk a little bit about the Test Iowa site that launched a few hours ago. This is an initiative that is organized by the governor's office, and we thank her for her efforts. While this is a state initiative, the health and safety of our residents is our top priority, so we will share all of the information we have about this project, and we will do the best we can to make it a success. Citizens who wish to be tested at the site should go to testiowa.com and complete the questionnaire. If you qualify to receive a test, you should receive a QR code on your phone and/or other information about your scheduled appointment. Completing the assessment is required in order to secure an appointment. While priority is given to first responders and essential workers, everyone is encouraged to complete the assessment. The Test Iowa FAQ is being reviewed and updated regularly to address common concerns and questions that you may have. For more information, go to testiowa.com or contact the Governor's Office at 515-281-5211. Now I'd like to turn it over to Linn County Emergency Management Coordinator Steve O'Connick to give you a few more details.
Thank you, Supervisor Walker. Thanks for everybody for tuning in today. Appreciate the opportunity. Before I start, I would like to also extend my sincere thanks and appreciation to the nurses, healthcare providers that are working so hard during this time. I can't begin to tell you how much we do appreciate the work that you're doing. So as Supervisor Walker mentioned, Linn County established a Test Iowa site today. It started at noon. And Linn County EMA's role really is to provide local coordination amongst several partners. Iowa Department of Transportation, including DOT enforcement officers, the Iowa State Patrol, Linn County Sheriff's Office, and the Cedar Rapids Police Department. The Iowa Army National Guard is playing an integral role in management and maintenance of this operation, as well as the Iowa Department of Homeland Security and Emergency Management. Certainly we can't forget about our important partners, the Linn County Public Health Department, who have been with us throughout this and continue to remain. We've had the City of Cedar Rapids Traffic Engineering Department. Kirkwood College has been a great partner in this, and it helped us secure this site. I also want to thank our private medical contractors and the local businesses whose businesses may be affected by small amounts of traffic that may come there. Thank you for all your work and what you're about to do and what you have done. So as I mentioned, Test Iowa opened today at about noon. It'll run until 6 p.m. today, and it'll be the same hours tomorrow from noon until 6 on Friday. Beginning Monday, May 11th, it will run from 8 a.m. to 6 p.m., and these hours are subject to change, but it'll run daily from 8 a.m. to 6 p.m. until the 21st of May. The testing will not occur on the weekends, so there will not be any traffic at the site. As Supervisor Walker mentioned, the testing is by appointment only, so please fill out the survey at testiowa.com. Anybody without an appointment or anybody on foot will not be allowed to get a test. It's a drive-up testing site. All individuals should arrive and remain in their car, and this is for their safety and for the safety of the medical staff and professionals that are performing the work. The Linn County Test Iowa site is located, as I mentioned, at the driving center located at Kirkwood Community College in their continuing education and training center at 101 50th Avenue Southwest in Cedar Rapids. There's plenty of signs marking the location. The DOT and Cedar Rapids Traffic Engineering have looked at the local roads and looked in and analyzed the traffic situation, and they believe that they're able to handle those traffic flows. Unity Point medical staff has been contracted to perform the test collections, and this is mainly done to ensure that qualified medical personnel are the ones that are experienced in conducting and taking these specimen collections. Law enforcement, as I mentioned, will be on the site during the hours of operation, and security will be provided 24 hours a day, 7 days a week while this is running. If there's any traffic flow, and we don't anticipate there is much, law enforcement, as I mentioned, will be on the site to correct that problem. And again, our role really is to just make sure that this is a well-coordinated, smooth-running event. I want to take a minute to thank my Linn County Emergency Management staff and all of our partners for the work that they've been doing on this plan. Couldn't do it without you guys, so thanks a lot. If there are any further questions that I can't answer today, I would refer those to the Iowa Governor's Office. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. As of 1 p.m. today, there are currently 804 cases of COVID-19 in Linn County. There have been 55 deaths, and 542 individuals have recovered. Additionally, hospitalization data has now been added to the Linn County COVID-19 data dashboard. Out of the 127 Linn County residents ever hospitalized for COVID-19, 17 of those residents remain hospitalized. We want to emphasize that this data reflects hospitalizations for Linn County residents only. It does not indicate the location of hospitalization. Linn County Public Health continues to track and follow up with outbreaks identified in Linn County long-term care facilities. Cottage Grove Place in Cedar Rapids has 5 staff and residents that have tested positive, and 4 of those have recovered. Unfortunately, 1 has died. At Heritage Specialty Care, 113 staff and residents have tested positive for COVID-19. 25 of the residents have died, and 83 staff and residents have recovered. At Linn Manor, 26 staff and residents have tested positive, 6 residents have died, and 17 of the staff and residents have recovered. At Manor Care Health Services, 40 residents and staff have tested positive. 6 of the residents have died, and 11 of the ill have recovered. At St. Luke's Living Center West in Cedar Rapids, 63 residents and staff have tested positive for COVID-19. There have been 7 deaths associated with this outbreak, and 35 of the ill have now recovered. As previously mentioned, the Linn County Test Iowa site is opening today. We encourage all Linn County residents to complete the assessment at testiowa.com. Linn County Public Health will be doing all of the communicable disease follow-up for all COVID-19 positive individuals, including those tested as part of Test Iowa. We will be responsible for our Linn County residents only. Anyone wishing to be tested as part of the Test Iowa site must go to testiowa.com to take the assessment to determine if you qualify for testing and to schedule the appointment. I want to thank Supervisor Walker and Steve O'Connick from EMA for their updates on Test Iowa. The Governor's Office is handling the implementation of the program. Therefore, if you have any additional questions, we ask that you contact the Governor's Office at 515-281-5211. Linn County Public Health is hosting a virtual town hall tomorrow with representatives from Public Health, Unity Point Health in Cedar Rapids, and Mercy Medical Center. This is a time where Linn County residents can ask our local healthcare and public health professionals questions about COVID-19 testing. For more information, visit the Linn County Public Health website or social media channels. Yesterday, the Governor announced a State of Public Health Disaster Emergency Proclamation which impacts Linn County. The changes announced are effective at 5 a.m. tomorrow, Friday, May 8, and these include that dental services may resume if the dentist complies with prescribed requirements for use and conservation of personal protective equipment and transitions back to practice. Statewide, including Linn County, certain businesses may reopen if in compliance with the measures outlined in the proclamation. This includes campgrounds, drive-in movie theaters, tanning facilities, and medical spas. In Linn County, fitness centers, health clubs, health spas, gyms, and aquatic centers are closed, but may open on an appointment basis. Enclosed malls may reopen with certain limitations, including limiting occupants and closing seating and play areas. Social distancing, hygiene, and public health measures shall be implemented to reduce the risk of transmission of COVID-19. Other retail establishments previously ordered to be closed may reopen with limitations, including allowing 50% of the max legal occupancy and implementing reasonable social distancing, hygiene, and public health measures to reduce the risk of transmission of COVID-19. As part of our unified command system in Linn County, there is a business work group that is currently working to develop recommendations and guidance for businesses that will be reopening. We hope to have these recommendations finalized soon, and we will be working to distribute these recommendations through the Marion Economic Development Corporation and the Cedar Rapids Metro Economic Alliance. They will also be posted on the Gazette Coronavirus Business Resource page and the Linn County Public Health COVID-19 webpage. We encourage business owners and organizations to carefully consider their decision to reopen and to not feel pressured if they are not ready. If you decide not to reopen at this time, that is okay. We know that this is a hard decision for many businesses as you look to protect your employee and to protect the public. We want to remind you that reopening does not mean that you no longer need to worry about COVID-19 in the community. We continue to see community spread of COVID-19 in Linn County. Protect yourself, protect each other. Clean your hands often with soap and water or hand sanitizer if you cannot access soap and water. Cover your coughs and sneezes. Contain yourself at home when ill, no matter how mild the illness. Do not touch your face. Clean frequently touched surfaces often. Continue to practice social distancing. Wear a cloth face covering when unable to maintain a distance of 6 feet from others. We are aware that this mantra sounds like a broken record. However, your health and safety is why we are all up here today. We are in this marathon with you, and until we reach the end, we will continue to be here to provide education, guidance, and the assurance that we will make it to the end together. Thank you.
This is Caitlin Emmerich with Linn County Public Health. This is the end of our prepared remarks for today. We do have time for a few questions. And for our media partners, please indicate to the moderator if you'd like to be entered into the queue. In addition to our speakers, we also have Dr. Dustin Arnold from Unity Point Health, Cedar Rapids, and Daniel Gibbons with the Linn County Conservation Department available for questions. Are there any questions from our media on the line? I'm not seeing any, so I'm going to ask one more time. Oh, okay, here we have one. Can you announce yourself?
This is Brian Savick with KCRG.
Hi, Brian. Go ahead with your question, please.
So there's a couple of questions I have here. The county said that they weren't involved in planning the Test Iowa site. Obviously, today is the first day of that testing. I'm curious if the state has made your team aware that some of these tests are being described as broken. What are the concerns with this news?
Brian, I'm not sure if there's anyone in the room that can answer that question. I think several of our speakers today mentioned that the test is being planned by the Iowa Governor's Office. That may be a question for the Iowa Governor's Office that you have.
Okay, so that kind of follows with my next question. Is there a disconnect between the state and the local levels, and how is this impacting the fight, and what can be done better?
Do any of your panelists or speakers want to answer Brian's question regarding the communication? Okay, Brian, it looks like Supervisor Stacy Walker is going to answer your question. Thank you.
Brian is asking about there being a disconnect between the state and local governments. I can't speak for all local governments in the state, but I do know that some healthcare professionals and some folks that are involved in the government response has hoped for a little better communication. But I will say that everybody here in Linn County, our emergency responders, everybody here in local government, we're doing the best we can to make Test Iowa a success, and we're doing the best we can to reach out to the state when we have questions. I hope that answers your question, Brian.
Thank you, Supervisor Walker.
I understand we also have a question from Shannon Moody with Iowa News Now. Shannon, would you like to answer your question over the phone?
Yes, I can do that.
Go ahead.
Is there any count on how many test kits were sent to the Linn County Test Iowa site, and any number on how many people have been tested so far?
Shannon, I think that's another question for the governor's office. Thank you.
Thank you.
Any other questions for our speakers today? Okay, seeing none, that will conclude our press conference for today. Our next press conference is scheduled for Monday, May 11th at 3:30. I do want to remind our Linn County residents and our media professionals that may be listening that we do have a virtual town hall planned tomorrow at noon. So that would be Friday, May 8th at noon, to learn more about COVID-19 testing. Representatives from Unity Point Health, Cedar Rapids, Mercy Medical Center, and Linn County Public Health will be available for questions on how to navigate COVID-19 testing here locally. In summary of the Linn County metrics to date, we do have 804 cases, 55 deaths, 542 individuals that have recovered, and 17 residents currently hospitalized. Please practice social distancing, stay home when you're sick, and wash your hands often. Thank you.